Welcome back to Fort Wayne's smallest winner. I'm joined by Dr. Rob Shugart, one of the talented surgeons here at Fort Wayne Orthopedics. And Dr. Shugart, we're in a surgical suite. I have a feeling a lot of people would like to go most of their lives or all their lives never having to be a guest in this wonderful facility. How important is exercise to strong, solid spinal health?
Exercise is actually critical. People that are in good shape, eat a good diet, and exercise regularly have a lot less back problems overall than the person that does not do those type of activities.
What happens though if being in good shape and exercising regularly isn't enough? I know genetics can play a factor, perhaps just bad luck, things like that, where a person can try to watch their weight, they can try to be active and stay in reasonable shape, and they may still have some problems that creep up.
There are times that even though people do everything possible, people can have injuries, trauma, and in those situations there are a lot of new technologies available to treat them. Minimally invasive things that allow people to get back to an activity level quickly so they don't get deconditioned and they can continue to, keep their core strength up, as we say.
Now you talk about minimally invasive, and I put everything in sports terms. They always talk about when an athlete has to go under the knife. That may be a somewhat antiquated phrase because with some of these new technologies, you can do things, as you just said, are a lot less invasive.
Yes, there are a couple of techniques we use. We have a technique where we can actually use a laser in somebody that would develop a herniated or bulging disc in certain patients. We can use a laser that we can go in through it's actually just a large needle where you can go in, access the disc, remove it. People can be up and out the hospital an hour later and then rehab quickly and then get back to their activities they like to do.
Dr. Shugart, you talked about the challenges people who are in reasonably good shape or people who are active and exercise regularly. What then happens to the person who is significantly overweight? This obviously puts a lot more stress and duress in their spinal situation.
Yeah, there are studies that show that people that are overweight or obese have increased back pain, and that really comes from degenerative disc disease that gets accelerated and arthritis in the back, and those conditions then lead to other problems in the future.
And it seems like that's key because what will start in your back, and your back is just so critical, your spinal situation. If you go upwards, your neck area, if you go downwards into your hips and then below that. So I would suspect solid spinal health is just paramount to probably overall good health.
Right, it can be a downward spiral from there, you're right. The back can be a problem, that can affect the knees, that can affect the hips, and then people can develop multiple areas of degenerative arthritis because of that one issue.
And we were talking about before we did this segment that I've heard research has said for every pound less you weigh, it can take up to 4 pounds of stress off of certain joint areas and things like that. I suspect the key is the less you weigh, the less stress there is then on some of these key elements of your skeletal system.
Absolutely, it takes the stress off your back, knees, and hips, and hopefully gives you the ability to stay out of a room like this.
Which I think everybody would like to do, and obviously you've talked about new technologies. This is a suite that looks like it's almost from another planet, and it's amazing when I think of new technologies that are developed probably monthly and annually. And you've also talked about there has been some stem cell research and things like that that can help out?
Yes, in addition to lasers and motion devices, there's a lot of exciting research in using adult stem cells to treat various conditions in the back and other joints, treating degenerative disc disease, and a lot of these studies are just beginning, hopefully being able to stop people before they have to come in and have a big surgical procedure.
If you would give anybody some advice, especially for people who say, okay, I've been overweight either for most of my life or for a period of months or years, I think one of the most important things is not overdo it. So what would be a good solid first step, and then where somebody could progress into trying to take the weight off, to take the stress and pressure off of the spine and things like that, so that maybe they don't get too carried away or they don't make some sort of a mistake where ultimately they don't have to see you.
Right. I always tell people it's never too late to start, and you have to start, like you said, in baby steps. I mean, you really have to start with diet and then exercise and do it in a slow, progressive manner. Sometimes you may need the help of a nutritionist, or you may need a trainer, somebody at a local gym just to help you out. But if you can do this in a stepwise fashion, you can avoid potential injury and then hopefully prevent some of these problems in the future.
And I've always heard over the years, just sitting properly, having a proper posture is important as far as your spinal health and things like that. So I suspect when you talk about working with the trainer or when you start to work out, you do want to work out and exercise properly and have the correct form so that you don't risk an injury to kind of magnify a potential problem.
Yes, absolutely. It's how you lift, how you sit. What they do is they teach you basically how to function, and along with the other things you're doing, hopefully protect those areas from having any further injury.
Dr. Shugart, thanks so much for the information and the advice, and I know that people who are watching this program, people who are contestants, and I myself, hope that one day I wouldn't have to be a guest of what is an outstanding surgical suite, but obviously it'll help somebody, but hopefully they don't get themselves in the condition where they need that help.
Right. Like I said, there are a lot of new things coming available that, we can get people back to their activity level quickly and back to work and doing the things they like to do. So,
Dr. Rob Shugart from Fort Wayne Orthopedics will be back with more of Fort Wayne's Smallest Winner.